Hello, welcome to the final session of today, which is improving public services. I seem to have lost a word. My name is Dr. Gabriel Lawson. I'm a research associate at King's at the Policy Institute. I've been working with the Centre for the last 2 and a bit years on policy impact. Over the course of its existence, the Centre has done an awful lot of work which is really, really relevant to improving public policy at kind of a local and national level. This is in addition to the academic impact. We're thinking about influencing policy change. We're going to get a taste of some of that today from a series of presentations from centre researchers with research projects that have that kind of direct impact into policy. And then we're going to get a panel of experts to talk about policy change more broadly. First of all, we have Dr. Rebecca Reid, who's lecturer at the Centre for Society and Mental Health, who's going to tell us about the TIDES project. Okay.
Oh, thank you very much. Hello, everyone. Thank you. So I'm going to be talking about some work I did a few years ago looking at access to NHS talking therapies. A little bit of context to start us off with. There's a lot of evidence available now that suggests that ethnic minorities have an increased vulnerability to common mental health disorders. This is for a wide variety of reasons, but potentially due to things like racism, discrimination, and social inequalities. There's also lots of evidence now to suggest that they are also less likely to access health services. They experience lots of different barriers to care, including stigma, discrimination, potential language and cultural barriers, and in some cases, insufficient provision of care. So the NHS Talking Therapies programme is designed to provide equitable access, that's very hard to say at the end of the day, equitable access to therapy for everyone. It delivers cognitive behavioural therapy to treat primarily anxiety and depression. It does treat other kind of low to moderate mental health problems as well, but primarily anxiety and depression. And some initial studies that were conducted when this was being piloted, back when it was called IAPT, suggested that ethnic minorities were underrepresented in this service. And it's obviously incredibly important to determine if this is still happening. If you delay access to care, or if you are unable to access care, that can have very negative impact on your quality of life, can potentially make your mental health even worse. And so this, in the nutshell, is the aim of the paper that we were working on. The goal was to identify any inequalities in referral and treatment pathways for ethnic minorities trying to access NHS talking therapies. So for those who don't know, how you access NHS talking therapies is obviously you get referred. Most commonly you're referred by your GP. You can also self-refer, but technically anyone can kind of refer you. And then once you're referred, you are assessed to determine if NHS talking therapies are suitable for you. If you have more like severe or complicated mental health problems, you might be referred elsewhere. But generally, if you're deemed to be kind of suitable for NHS talking therapies, through that assessment, you should then start treatment quite quickly. So the goal was to determine if there are any variations by ethnicity in the way people are referred and whether they receive an assessment and then whether they start treatment after they've been assessed. So where did I get the data from? I got the data from the South London and Maudsley NHS Trust, and that provides NHS talking therapies care to over 1 million people across 4 different boroughs: Croydon, Lambeth, Lewisham and Southwark, and these are very ethnically diverse areas with a greater number of Black Caribbean residents than other London boroughs. I won't spend too long on this slide, but just briefly to say that I had about 85,000 people between the access to service between 2013 and 2016. 2013 was the first year that all 4 of those boroughs had an NHS talking therapy service that was properly up and running, and 2016 was the most kind of recent data I could get my hands on at the time. Most of the sample were white, female. The largest ethnic minority groups were Black Caribbean and white other. As you would expect, most people were referred by their GP. Most did receive an assessment and at least one treatment. And one of the issues with that data, very quickly, is that almost 20% of the sample didn't have ethnicity data. So that means for 16,000 participants, I didn't know what their ethnicity was. And I won't go into any of the detail here, but I did multiple things to try and address this issue. If anyone is interested in missing data and multiple imputation, please do come and talk to me after the session, but I won't bore you with it now. And just to quickly summarise my findings, so I know I haven't got that much long to talk. When looking at referral, we found that Black, Caribbean, Asian and mixed groups were less likely to self-refer, and that is potentially a problem because that means that maybe they don't know they can self-refer, or maybe they're not aware for whatever reason that they need this particular kind of therapy. Even more concerning, some groups, particularly the Black Caribbean and Black other groups, were more likely to be referred into the service via community services. And by community services, I mean kind of non-healthcare services. So this is like the council, charities, the job service, the prison service. And this is potentially a problem because it means that these people are not designated like as carers for your mental health. It could be that these people have not engaged with mental health services, their mental health has gotten worse, and then other services have had to kind of step in and intervene. So looking at assessments, once people were referred in, ethnic minority groups were less likely to be receive an assessment compared to white British people, either because there was a lack of engagement from either the service user perspective or from the NHS talking therapy side. And then looking at treatment, once people were assessed, ethnic minority groups were less likely to be treated. So what might explain all of this? Why aren't there more GP referrals for ethnic minorities? It could be that their symptoms are not being properly recognised, either by the GP or by the service users themselves, potentially a lack of mistrust from healthcare services because of negative experiences in the past. It could be, one of the reasons why they're not being assessed or treated could be that once they're kind of, assessed, or before they're assessed, someone realises that they have more complex or comorbid mental health problems and maybe they're referred elsewhere. There is a lot of research into treatment avoidance due to shame, fear of secrecy, and potentially language barrier might be one. NHS talking therapies do have translators, but they don't have them everywhere, and they don't have them for every session, which is a massive problem. So what can be done? I think recording ethnicity properly is a really good first step to properly understand the problem and make sure we have enough data to properly look at ethnic minorities properly. Ultimately, it's NHS talking therapy's responsibility to make sure this data is properly recorded. And we really need to kind of stop and think about how we meet the needs of ethnic minority service users. So we need to do more to facilitate more referrals for ethnic minority groups, consider the barriers to care that they experience when they're trying to engage with NHS talking therapies, and try and factor in that potentially their mental health has gone untreated for some time. A few references, and that's all from me. Thank you very much.
Thank you, Rebecca, for an absolutely fascinating paper. To borrow a phrase from Jay's session earlier, shocking but sadly unsurprising that NHS-TT doesn't record ethnicity data properly. And yeah. Just before we move on to the next presentation, a little bit of housekeeping. There will be some audience participation towards the end of the session. So if you've not already, over the course of today, could you, on your phone or device, sign into the Wi-Fi, because that will be required. If you look, the cloud Wi-Fi will be available for everyone, not just King's people. Our next presentation is from Jonas Kittisu, who is one of the young person community champions on the REACH project, as Craig described earlier. Jonas?
Thanks for the introduction. My name is Jonas, and today I'm going to be talking a little bit about policing, particularly with police contact and how that can affect mental health for young Londoners, and where policy kind of plays into that as well in improving the relationship between people in the community. But first, a little bit of background. I'm part of the YPCC on the REACH study at the centre. So we're a group of 5 young people. We've been working with REACH for about 3 years now, and we help the research team analyse data from our lived experience perspective as young people from South London. We were all also members of REACH schools. We've co-authored reports, and we also produce social media posts, blogs and podcasts to disseminate to our fellow young people and to the wider community who want to learn about REACH. And we co-produce and co-deliver events. Particularly, one of the areas of research that we've worked with the team on was on stop and search and policing. And for a bit of background, stop and search is a police power, which essentially gives the police the power to do exactly that, stop and search. Reasonable grounds are needed for police officers to carry out stops and searches, but this has been very contentious and come under scrutiny in previous years because there's not always reasonable grounds present, and this has serious mental health implications. There are also various inequalities that exist within current stop and search powers. For example, black people are 10 times more likely to be searched than their white counterparts. They're more likely to have force used on them, and they're more likely to be handcuffed and searched under harsher Section 60 stop and searches. And this is of importance to us as community champions on REACH, because the REACH cohort is of young people from Southwark and Lambeth, which are two inner city boroughs, which, as you can see, have a high volume of stop and searches in comparison to the rest of London. Most stop and searches also are carried out on young people, so statistically, our young people on the REACH cohort are more likely to experience police contact in the form of stop and search. So it's their experiences that are really valuable to hear, to see the effect of stop and search on mental health. And from the data from the study, this is research from about 3,000 young people, 1 in 7 young people on our cohort had been stopped, whether that was stopped and questioned or stopped and searched. And it's a particular issue among boys, as more boys are likely to be searched than girls. There are also racialized inequalities within stop and search. Black Caribbean boys are far more likely to be stopped and searched compared to their white British counterparts. And as you can see, young people from ethnic minority backgrounds are at a higher disposition of being stopped and searched. And the links between stops and searches and mental health are clear. 1 in 4 young people who had been stopped were at risk of experiencing general mental distress, compared to 1 in 6 of young people who hadn't been stopped. So there's a very big link between the prevalence of stops and searches and mental distress amongst young people. And we wanted to find out what young people's experiences of this were. Now, in our reflections from other young people, which we found through forums and events we held with our fellow peers in the community, you can see that young people don't have a particularly positive view on the police or on stop and search. They believe the system doesn't work, they believe that it should be abolished completely, and that when you ask young people what their thoughts on stop and search are and on policing, things that come to mind are racism, intimidation, and an abuse of power. We held a forum with young people and asked for their thoughts on what comes to mind when they think of the police. And you can see the negative connotations, such as discrimination, racism, and abuse of power. We also asked how institutes like REACH and like Black Thrive can support young people who have had negative interactions with the police, which leads me on to how here at REACH, as young persons community champions, we've been involved in shaping policy to help impact the relationship between young people and the community and the police. Last year, the Mayor's Office for Policing and Crime commissioned the Black Voices in Policing consultation, led by Black Thrive and PSI, and we at REACH, us as young people's community champions, were involved in various ways. We co-hosted online forums with other young people and also with community leaders on the effects of policing. We were involved in working groups with the consultation with other members of the community, particularly Black members of the community, who had experienced or had any contact with the police, whether their own personal experience or experiences within their community. And we were also involved in smaller young persons working groups to specifically represent some of our REACH findings and also get what young people's thoughts were. And from these consultations, as a result of the MOPAC consultations, 6 recommendations were formed that MOPAC will use in order to develop better community relations with the community, beginning by building trust and confidence in the police service, forming independent bodies for scrutiny, adopting a framework similar to one that exists in the NHS, building trust to engage young people specifically in accountability mechanisms, because we don't think young people are involved enough in scrutinizing the actions of the police, when a lot of the time young people are directly affected by negative police outcomes. Improving the effectiveness of local accountability groups and collaborating with voluntary organisations. All of this in order to foster a better relationship with the Black community and with the police. And I think this really accurately highlights the connection between lived experience in mental health research and policy outcomes. I want to thank everyone for listening, thank all the young people on Reach.
Thank you, Jonas. Wonderful presentation about some absolutely brilliant work. One final presentation before we move on to the panel. This is Anna Greenberg and Helen Baldwin, who are research associates at the Centre, who are going to talk to us about the ongoing ENRICH study. Guys?
Hi everyone, thank you. So yeah, I'm Helen and I'm presenting today with my colleague Anna Greenberg on the ENRICH project, which we've been working on over the past year or so. And although it's the two of us presenting today, this is representative of a much wider collaborative network of researchers both in the Centre and advisors out externally. So just to get started with, I'll give you a bit of background. So I think this project has a really strong rationale. As I'm sure lots of you are aware, people with a diagnosis of psychosis typically experience social exclusion across a number of different domains. So this might be, for example, experiencing greater social isolation or poorer financial situations. And we often see that this social exclusion is greater in people from minoritized and marginalised communities, such as racialised groups. And unfortunately, our current provision is really reinforcing some of these inequalities. So with a very dominant focus on a medical model, often social needs aren't adequately assessed or adequately addressed in services. And this creates a sort of cycle of social exclusion and worsening mental health, and the ENRICH project was aiming to kind of understand this cycle a bit more and how we can begin to interrupt it. And so I'll start just by giving you a very quick overview of our systematic review, which took quite a global context. And although the project was broadly focused on psychosis, we took a sort of wider perspective for this particular work stream. So we wanted to identify any interventions which aim to improve the social or economic circumstances of people living with any mental health condition. We identified 267 studies across 34 different countries which fit this criteria. And when we took a closer look at what kind of interventions were on offer and where the existing literature was kind of clustered, a lot of this was around things like employment, housing, and social connectedness, with a lot less or little to no research focus on things like income, debt, social security, welfare advice, etc. And one key aim of this particular work stream was to kind of understand how well different socio-demographic groups were reported and represented within the literature. And we conducted these analyses across a range of different socio-demographic constructs, but I'll just give you, in the interest of time, an example from the race and ethnicity work stream. So when we took a look at how well this data was reported across the included literature, unfortunately found, as has been reported across a number of different talks today, really inadequate reporting in relation to race and ethnicity. So only 53% of studies actually reported any data relevant to this, which already identifies a huge problem with working out what works for whom. And to take it one step further, we wanted to have a look at if there was any data which described whether effectiveness of interventions differed on the basis of different socio-demographic features. And again, for the example of ethnicity, only 1% of studies actually reported this data. So we have a really poor understanding of how interventions work for different people. And so lastly, we had a third key aim of looking at whether targeted intervention might be effective for these groups. So we conducted narrative synthesis across a range of different features, but just, I think, 27% of the included studies presented some kind of intervention which was adapted or developed for a specific socio-demographic group. Just 2 of these studies were specific for ethnicity or racialised groups. One of these was an adapted housing first intervention, for example, and the other a adapted family intervention for people from African Caribbean backgrounds, which both respectively showed great acceptability and effectiveness. So I think really show the potential utility of targeted intervention. And whilst this project took a bit of that particular work stream took a sort of broader scope, we were also really interested in this project at understanding what was happening within the local context in South London, and Anna is going to provide a bit more information on that for you now.
Hi, thanks. Yeah, so as Helen said, I'm going to talk a bit more about the local context in terms of what's happening in South London and Maudsley right now to do with social inclusion and psychosis. A really cool part of this work has been some workshops with people with lived experience that Gabrielle at Black 5 has run, and Gabrielle will be on the panel afterwards, but I'm not going to talk about that just now. I'm going to talk about our work we did about mapping need and support in SLAM. So as you can see, the map on the left is of the South London and Maudsley catchment area. And our colleague Dion analysed electronic health records to identify hotspots of psychosis prevalence in these areas. And you can see these in red, so they form a kind of belt across the northern parts of Lambeth, in Southwark and Lewisham, as well as parts of Croydon. And these higher areas of psychosis prevalence corresponded to area level factors such as multiple deprivation. And this can kind of give service planners and policymakers a real idea of where community services need to be most strengthened if they're going to be effective and accessible for people with psychosis, as well as the kind of contexts that they're dealing with. We also ran a service audit where we asked lots of different types of staff members working across a variety of community teams to fill out a survey. And we asked them about how social and economic needs are currently being assessed and addressed. As you can see from this graph in the middle, some types of domains are being much more consistently assessed than others. So family relationships and social connectedness, much better assessed than debt, income, and victimisation. And this chimes with our systematic review of these financial needs often being kind of overlooked. And in every single one of the domains we asked about, these staff members said there was a real lack of adequate support in every single one of the domains, as well as some additional areas such as sex and relationships and healthy eating. What support was available is provided by a real variety of different teams, both in the NHS, but as also local authorities and many, many charities and other community organisations who are really doing a lot of the work in this area, which just gives you an idea of the complexity of the landscape that service users have to navigate when trying to actually find help with the social and economic challenges they're facing. But as well, it gives you an idea of the massive variation in support. So depending on where you are, in South London and Maudsley, you might be only accessing a tiny proportion of this support. We also ran some theory of change workshops with people with lived experience, as well as service providers and people working in third sector organisations, run by the brilliant Anna. I don't know if she's in the room. She basically helped us facilitate this workshop where we're trying to really ask how we can make social inclusion more central to the way mental health services work and really make it the core business of mental health services. This is an iterative process, so we're not going to go into the full theory of change model, but some really core recommendations are already coming out. For example, we really need to improve data collection about social inclusion for service users throughout services and establish key performance indicators to ensure that services are starting to meet the challenges that people are facing. We also need to increase access to fundamental building blocks, in particular access to support with social security and finances. And finally, a key theme through a lot of this was we need to try and build trust with service users through genuinely person-centred, culturally appropriate care. Someone in our workshop said that services right now are service-centred rather than person-centred, so that really needs to change. Thanks for listening to us. And we wanted to also say a particular thank you to Lambeth Vocational Services and Southwark Community Welfare Team, who are doing amazing work in the area of social inclusion already. And we go into a lot more detail about exactly what they're doing, as well as the challenges they're facing in our report. Thanks.
Okay, thanks both. One brief final presentation from yours truly before we go into the panel session. I'd like to just talk a little bit about the policy labs which we held earlier this year. I should say they were delivered in partnership with the Centre for Mental Health, Centre for Society and Mental Health, 2 centres, 2 labs. So what is a policy lab? I hear you cry. Policy labs are an approach developed by the Policy Institute at King's. They're all-day collaborative workshops that seek to provide solutions to really entrenched, really difficult, tricky policy problems. On any given topic, we'll get in the room researchers, policymakers, practitioners, and of course people with lived experience, all contributing their own experiences, all sharing their perspectives with us. We can therefore try and start to create policy solutions which come at a problem from all angles and have potential pitfalls already kind of considered and thought through. As part of the process, we try and develop an overarching question. So what is it we're really seeking to do here? What's the question we're going to try and answer? We also put together a briefing pack with all the relevant evidence we can find on the topic. So for these labs, we focused overwhelmingly on centre evidence. It included some of the things you've heard about today. So for example, the Tides Project was mentioned, Stop and Search was in there. The question we sought to answer was, and it's a bit of a mouthful here, how can public services be reformed so they perform better against their broad social purpose, more effectively meet the needs of diverse individuals and communities, promote mental health, and simultaneously cause no harm? You'll see there we had a really complex question to kind of ponder. We're trying to consider some of the major flaws with public service provision currently. And in order to answer this, we brought together a really diverse group of people. We had centre researchers, we had members of the LEAB, some of whom are here today. We had practitioners from various different public services, including healthcare, education, and we had experts in policy change, and also representatives from the third sector. So a very diverse group of people all brought together into the room to try and answer this question. Prior to the first session, we identified 3 services we wanted to focus on to start with. You may notice that this maps perfectly onto the Centre's 3 programmes of research. So, education, asylum, and welfare. Each of these services can have a powerful influence over the mental health of those who interact with them. In our second session, we also covered healthcare as well. Participants were really, really keen to talk about the NHS and to talk about the changes that they perhaps want to see there. It was felt that we wouldn't have done our duty if we didn't cover healthcare and mental health care as well. So the full report will cover that in addition to these 3. At the core of this kind of process and this thinking was the principle that public services which fail to perform properly can result in avoidable harm to service users. When assessing the evidence here, we found that people most in need of public services often had the worst outcomes, notably described by Julian Tudor-Hart as the inverse care law, where people who are most in need of healthcare are also the least likely to receive it. We also found when we assessed the evidence that those who are most likely to be impacted by dysfunctional public services tend to be marginalised in some way, whether that's based on gender, race, poverty, disability, or another characteristic. We found that mental health plays a key role in the failures of these services, both in terms of poor mental health making it harder for people to engage and to access the help they need, and in terms of mental health harms from dysfunctional services which fail to give people the help they needed when they needed it. When public services function well, they can seek to boost the protective factors that help people to enjoy good mental health and reduce the risk factors. Unfortunately, public services do not always perform in this manner. Policy changes which reduce discrimination, so for example, ending hostile environment policies or preventing school exclusions that disproportionately target racialised children, they can also improve mental health outcomes. That might not be the grounds which policymakers want to hear, but policy change can do that. So in our first session, participants agreed to identify and map out a number of relevant principles. Rather than starting with policy objectives and working backwards, we wanted to go back to first principles and find out what, if we are going to re-envision public services, if we want to see systemic change to the way that services are delivered, what principles do we want to base those around? Public services aren't just based around specific objectives. The education service isn't just based around teaching kids their ABCs. There's a deeper, broader social purpose which spans the entire public sector. And this includes concepts such as ensuring people can access the basic rights they're entitled to, improving public health, including mental health and well-being, creating community cohesion, and finally tackling injustices and ensuring inclusivity. Sometimes this is explicit in legislation, for example, the Equality Act. Sometimes this is just implicit within services, but it's not just about policy objectives. We have to think deeper. So, over the course of the first day, we mapped out 10 principles, which you can see here. You could organise these in a number of different ways. You could cut them in different ways or rearrange them, but I think it's worth seeing them in their entirety. When participants reconvened for the second session, the second kind of all-day workshop, they re-endorsed these principles. They confirmed they were happy with them, but they began to think about how policy change based around these principles could improve outcomes across the public sector. Participants were particularly enthusiastic about grounding principles in established rights, making clear that public services aren't just about narrow policy objectives, they're also about meeting everyone's individual needs. In addition to thinking about principles and kind of broad change, we did map out potential barriers as well. Things like institutional inertia, which makes it harder for reforms to take root, and discriminatory attitudes within services and by service providers. We sought to operationalise these principles a bit and map them against real-world policy change. So participants identified a wide range of changes which they might want to see across the free systems I mentioned earlier and healthcare as well. All of these were expected to deliver measurable impacts for the better. So sustaining mental health or reducing mental health harms. And out of this long list of recommendations, we then asked participants to prioritise a smaller number. Some of these policy recommendations were really specific. So, for example, ensuring free school meals for all children and the creation of safe routes for refugees and asylum seekers. Some of them were much more general. So we did talk about an end to surveillance culture currently present in many public services, particularly the DWP, but not exclusively, and the introduction of genuine co-production and user involvement across all public services. I don't have time to list all the recommendations here, but the full report will be out later this year, which contains both the principles and all the recommendations coming out of them. Right, we're now going to broaden the discussion out a bit to think about the various different ways in which mental health researchers and people with lived experience can impact policy. In addition to the presenters from earlier, we also have Gabrielle Duberry, who's CAPSA Service Manager at Blackfriars, one of our community partners. We have Professor Hannah Kienzler, who is co-director of the centre, and we have Professor Ben Geiger, who leads Programme Free. Would everyone like to take a seat? Good, we do actually have enough seats, so I was slightly worried there. I'd like to start by I'll get the discussion started. Rebecca, thinking about the NHS, it's obviously a body that attracts a lot of attention, a lot of kind of public concern, but also public enthusiasm. The Tides Project, are there any unique challenges you can think of associated with research into the NHS as an employer, as a public body? I'm mangling this a bit, but...
I know what you mean. So for the Tides Project, for example, we kind of look at discrimination both from the service user perspective and the service provider's perspective. And the challenges of kind of studying from the service provider's perspective is that you're dealing with kind of racism at an institutional level. And when you're working with people who their livelihoods kind of depend on them sometimes not rocking the boat, you have to be very aware that the things they've experienced not only affect their mental health, but can also potentially affect their livelihoods and their careers. And so it's just being very mindful of that when you're working with them, trying to kind of reassure them, and also giving them the space to kind of speak and be believed. I think that came up quite a lot when we were working with stakeholders. A lot of people, when we allowed them to kind of talk about their experiences and listened and believed and understood them, they felt kind of relieved that they at least had some space that they were able to do that. So it's, I think, in a nutshell, it's being mindful that these experiences not only harm their kind of mental health and physical health, they harm their ability to provide care, do their job, but also could potentially threaten their career if that data and those responses aren't handled properly.
Okay, thank you. Jonas, thinking a bit about lived experience, what role does that have to play here? How can we better integrate lived experience into both research and policy making?
I think, firstly, it's about seeing the value in lived experience, particularly in research. For example, if we want to focus on policing, for example, stop and search policies was something that were created broadly to serve a particular purpose, but because so much of the negative impact of stop and search occurred in marginalised communities, engaging with members of these communities and listening to these lived experiences are really the main ways in which the negative effects of these policies that are more widespread can be heard and can be communicated to policymakers and in research. So I think engaging with people who have experience of the negative sides of widespread policies is really a main way that lived experience can be used in order to improve the state of policy, for example.
Mm-hmm. Changing things for the better. Thank you very much. Gabrielle, what role can third sector groups like Black 5 play in the relationship between research and policy change? I'm aware you guys have a bit of a unique position here.
Yeah, so is it on? Okay. Yeah? Hi, can everyone hear me? Okay, yeah. There we go. So I think what Jonah said kind of really put it into perspective about using that lived experience and actually champion their voices, because a lot of the time they aren't heard. So by third sectors who actually sit on the ground and actually do the work, they can actually impact that change. And I think because we have that unique position of being grassroots, a lot of the time it kind of helps with being able to actually carry out the actionable impacts that are coming out from the insights from the research. And I think I can only speak to Black 5 and what we've done so far. One of the things is obviously the Enrich project, and that is one of the big things that we're able to champion the voices of the lived experience. But not only that, we're actually co-producing that part of the research with them and making sure that their voices are heard and actually taken into account when looking at what the impact is going to be afterwards. And I think you look at things like PCREF and Black 5 have had a really big hand in that, and that's from Jackie, and that's been able to be a policy that is now nationwide throughout the NHS, and that also goes to the culture of care as well, which Black 5 are also a part of. So these things in themselves show that these things can happen, and it means that we're actually making that impact of change for the communities, because not only are we doing this for ourselves, we're doing it for the communities that we serve, and it's not for us at all. So yeah, that's it.
Wonderful, thank you. Ben, question for you. Why is the voice of lived experience struggle to translate into policy change? And I'm thinking particularly of social security here.
Yeah, so in the sort of social security world, there for a while now has been really amazing initiatives that get people with lived experience to talk about how the system could be improved. So the Commission on Social Security, led by Experts by Experience, which is a great initiative with a very long title, and the Changing Realities Project, and before that the COVID Reality Project, led by Ruth Patrick at York, and lots of kind of activism, like Disabled People Against the Cuts, and Spartacus before it, and many other such things. So all of these things exist, but they tend to be really marginalised from social security policy making. And there's lots of reasons behind this, and I'm interested in hearing your views in the discussion too. But sort of challenged by Gabriel in this, I guess 3 things came to mind. So one of them is trying to think of models of bringing lived experience into conversation with centres of power. So DWP, well, as we'll come to, DWP and wider government policy making, it's a very centralised area compared to some of the other policy areas. And there are conversations with people with lived experience, but they're not often the conversations where really serious decisions are being taken. And trying to think of what models for discussion and involvement there could be to go beyond what we have at the moment. I guess the second one is policymakers, particularly politicians, endless reaching for simple solutions, like simple solutions that we know don't work and that people with lived experience know don't work and the wider evidence show doesn't work, but policymakers refusing to grapple with the difficult questions and going with something easy in its place. And I guess the final one, which maybe some people aren't so aware of, is I don't think DWP are the main problem. I think the main problem in this space is the Treasury. where people in the Treasury often have very little understanding of mental distress and wider health and disability issues, and often DWP are carrying the can for something that the Treasury have imposed on them, and you can see potentially this dynamic unfolding on the new government as well. And so what I'd sort of say around that is, you know, to influence the Treasury takes a wide range of actors working together, activists, researchers, campaigners, but those are the people that really need to be part of that conversation with everybody else, and too often those Treasury conversations are separate.
Okay, thank you. Hannah, question for you. How can researchers help ensure that marginalised communities can have their voices heard in debates over public policy?
Yeah, thank you. I think first of all, it's very difficult for research to be heard in public policy debates, let alone people who are marginalized. But I do think we have a role to play as researchers. So working with people who are from marginalized communities, we need to ensure that the work we do actually has the potential to improve lives, health and well-being. To achieve this, I think it is important to work really in partnership with people to ensure that marginalized communities have a say-so in terms of what objectives a research have, what questions we're asking, what methodologies we're using are involved in data collection, interpretation, and dissemination. It is important that communities co-own the data, and I think we are still far away from that. I think we're very happy for people to disseminate knowledge, but we're not necessarily making them owners of that knowledge, of that data, of that knowledge. And I think through this kind of a pathway, it is possible to have voices heard. However, we are also working in institutions like the university that are extremely hierarchical, where the power differentials are just extraordinary, where marginalized communities are prevented from applying for funding, from being PIs or even co-Is on grants, who cannot determine what an ethical research process is to look like on their own terms. So we're still far away from that. We're really struggling to pay people properly. There's so much red tape, and I know our center manager, research managers, they have struggled so much just to get this off the ground at King's, to really respect people for their time and their expertise. But then at the same time, of course, once it comes to influencing policy, there's still a lot to be done for different and diverse voices to be heard in that space. And yet, I think at the center here, at the Centre for Society and Mental Health, working with our Lived Experience Advisory Board, the Young People's Champions, peer researcher, it has been a real eye-opener for us, because research simply gets better. The outputs are better. Our reach into communities, it's much greater. And so just also to say that we're hugely thankful for that and sort of the advice and guidance that we received through that.
Okay, thank you. One final question before I open it up to the audience. And Anna and Helen, I think this is particularly relevant to you guys given the Enrich project. How well do you think mental health research is currently integrated into policy making? And that could be at a local or a national level.
Yeah, I can kick that off. I think from my experience on this project, to take the systematic review, for example, there's definitely been some successes and initiatives that have been really widely rolled out and implemented nationally and internationally. So Housing First is an example of that, but then also a ton that haven't seen it pass the literature. I think one thing that really stands out is in our conversations with healthcare professionals and service providers and service managers, quite a frustration around the expectation that in order for the research to impact the policy, we require these really huge research paradigms, multi-centre RCTs, and lots of this evidence that just some places don't have the resources or the funding to undertake, and maybe that's going to require more of a prioritisation of qualitative literature in policy development as well, and listening to, service user voices. Anna, I don't know if you have anything to add.
Yeah, is that what? Yeah, yeah, exactly what Helen said, and also, I think there's often this idea that the order goes research, policy, then implementation, and actually, and I think I probably had that idea as well until actually getting to work on this project. And really, the way change actually obviously happens, even within services, is often it's just a couple of really, really motivated people deciding to change things, and it's policy and research is often catching up. And actually, I think a lot of people said to us that they would be really well supported by research efforts coming to them to help provide them support in terms of evidencing what they're doing. So I think we all need to be a bit more dynamic and learn from each other a bit more.
We need to flip it round.
Can I just add
Gabrielle,
that
do you want to
really
come in? Yeah.
quickly? So I think from working on this project and also as well what we do within Black Thrive, it is mainly kind of, like you said, a couple of people who are really interested in what's going on and trying to change things. And system change is something that takes people to advocate for the voices of the unheard, really, and those marginalised groups. And then it seems that policy may catch up. Sometimes it doesn't, but the research always does because of the insights that are coming out from the changed work, and maybe the policy change, or not really the policy change, but mainly the kind of change in practice that staff have, or change in practice that the services that are actually impacting the work for the service users have, that then research is like, oh, actually, maybe we should do this, and therefore then policy then has to catch up to marry up with the kind of insights that are coming out from both the services and also the research that comes out from looking at the, services that are doing it.
Okay, thank you. Would anyone else in the panel like to come in, or should we open up to the audience? Yeah. Oh, question here.
Thank you for everything you said. I just wondered what you think about this. My husband's a freelance careers advisor, and he did some work, evening work, with some young people in Brixton, not that long ago, and it was quite dark for when he was going to go home. My husband happens to be white, and the guy who was in charge, my husband didn't ask this, who happens to be black, he offered to walk him back to Brixton railway station to make sure he was safe. That's what he said. What does anybody think of that?
Don't think the panel has anything to say. Any other questions from the audience? Oh, Raza. Sorry, could someone get Raza a mic?
So yeah, my question is that obviously...
Raza, Ginny's just got a mic behind you there.
Okay, thank you. So my question is obviously the focus here is very rightly on research and involvement, co-production, whatever you want to call it, and improving that, and that's really important. But you've kind of alluded to the before, which is the sources of funding and money, and the relationship is slightly Byzantine and not very clear. And then what happens after the research, which is the policy making, and that also appears to be slightly Byzantine, and kind of the relationship between these two things is unclear. So I'm just wondering, is there any scope for more kind of involvement in the funders and also the actual policy makers? Because presumably the end result of research is to obviously make a difference, and I think that's... of course there are initiatives which do make a difference, but it feels that they have to negotiate in a very weird and Byzantine kind of way, and the pathway to making kind of more informed policy is by no means very clear, or, so that's my question.
Okay. Would anyone like to come in on Raza's question?
I can come in on both questions, actually, and I think with your question that you mentioned, what I think about that is there is a lot of things that are going on, and even within the black community there is still that idea of the perception of what is going to happen when not necessarily will it happen. And I think sometimes that perception takes more hold than actually looking at the reality. And I think sometimes that it's a bit of a hard one, because at the moment, with this kind of age of austerity and everything, that's the cost of living crisis, people are pushed to want to do things maybe outside of their comfort zone, or what is not, legal, because they have to find a way to get things, and I don't think that's based on race. I think just within Brixton there's a big, low, it's basically with the social deprivation that is there, that you may see some more of these things happening. It just so happens that the community happens to be black, but I think it's because of the money that's not actually going into that area sometimes, and that's what doesn't help it. But it is that overall perception maybe as well. And to comment on what you were saying, Raza, oh, you're there. I think, it takes advocating and it takes lobbying to be able to do that. And sometimes that is a little bit of a kind of, it is convoluted. It is the way that it happens, and it's a shame, but it is just what it is in that sense. And I think being able to advocate and lobby for things is actually how we are getting to where we are now. And I think if we carry on in the same way, things may be able to move when you have more people behind you.
Okay, thank you. Anyone else in the panel got any input on Rasa's question, or? No? Okay. Yes. Oh, sorry, Ginny.
Thank you. Just going, it's a bit of a continuation of what Rosa was talking about, I suppose. It's about power and the power imbalance. For a marginalised person who, I take myself as an example, I live in Camden, and I've experienced a lot of very oppressive, quite a lot of bureaucratic violence in Camden, and I've not experienced Camden as a caring borough, and now there's like a big new era starting where, wellbeing is everywhere, and we want to hear the voices of our residents, this, that, and the other. And it's a case of I've put my hand up to do a lot of different things, and I've always been turned down. And whenever I've been, lately I've been really interested in contributing to policy. And, I'm someone who can research. I've got a master's degree, and, and I have the brain cells, and still, it was no, you're not getting anywhere near the decision makers, And my question really has to do with when you are constantly kind of just put back in your place, I suppose, we're looking for expert by experience, but not you, thanks, How and when you have social impairments that are born out of your own lack of trust in the authorities, and also, lack of social capital, I suppose. How do you drum up this power that people can, start joining you? It's like, I feel, I write, for example, and I have no platform to put it in. Okay, I could put it on Instagram or do this or do that, but someone mentioned about the implications for career. Like sometimes, for example, I've been interested in putting things on LinkedIn, but then it's like, oh my God, you're going to come across as like this real, employers are going to stay away from you. And so I was just wondering if you had any ideas on how to, one, carry on being hopeful and having, what I want to say is not just to rant, essentially about what I've been through and what lots of other people have been through. It's about changing things going forward so that maybe other people don't go through, that stuff. But how do you remain hopeful? How do you remain, implicated? And how do you dust yourself off all of this rejection from just putting yourself forward and not having people really interested in what you have to say?
Okay, would anyone like to come in on that? How do you remain hopeful? Ben?
Happy to start, but others are probably more instinctively hopeful than me, so I can continue. I guess it also goes back to Raz's question too. So there's like a state answer and there's a broader answer of remaining hopeful. So the state answer is, we're at least in a moment where people are talking about lived experience a lot, and there's a new government in that is going to at least have to pay some lip service to some of this. So it's at least a moment where you can think about, can we push for this to be genuine, and what would actual moments, like structures of democratic decision-making that involve people with experience look by. In the social security space, we know that Scotland have tried this, because they've got like a legalised commitment to doing benefits with dignity and respect, and they've got these experience panels. But we don't know yet, because it takes a bit of time sometimes to realise that there isn't any power in something. Like, it sounds really nice, but does it go anywhere? So I think we need to have some critical conversations about, is this actually working? Is the loop being closed, or is it just some PR? But it is possible. There is a moment, and better things and structures might happen. But I guess more how to remain hopeful when the state structures aren't around there. And I say this as someone who's come this really late. Like, activist spaces are, when they're done well, are inclusive spaces where people will listen to each other and fight for change and try to give each other hope. And I say this as someone that has not historically been very involved in it and starting to come to it. And I cannot think of another place that you are more likely to get hope than trying to find other like-minded people who come together to try and fight for things.
Okay. Thank you, Ben. Anyone else like to come in?
I suppose I can come in a little bit. I think some of what you're saying is just to do, it kind of shows the systemic racism that is, and the structural racism that is actually here within London, which actually a lot of the talks have spoken about. So it's a very sad thing, but it's really unsurprising. And I think it's, in terms of to remain hopeful, much like you said, it was just to do with kind of finding like-minded people and running with them, and much in the same way that I said about finding your tribe and running with them in that sense.
Okay, thank you. If no one else on the panel has anything to chip in there, I think we've got time for one final question. Yep, gentleman on the end there.
Hi, thanks. Well, I'd like to just say thank you to all of the speakers, organisers. It's been a fantastic conference today. I think my question would be for Jonas, and kind of linking back to what we said about the hope. So you're a young man who's come out and spoken in this space about what you don't like and how to put forward and actually putting your money where your mouth is. I'd just like to commend you for doing that. What support are you getting from other organisations in the local area to help to take forth your what you're doing into a sort of wider remit, I guess?
Yeah, thank you. Firstly, and I would say within Reach, us as young people are really supported. So I guess a brief shout out to the centre for making us all feel like really included and for our perspectives to be valued, because we've been given as young people that space to look into the things that affect us the most, and to be able to present these. We've been able to present some of our findings at different conferences. We recently presented some of our most recent findings on BBC Radio 4. So being able to access these spaces where we can communicate some of the disadvantages and experiences that we might face to the wider public, they're all really valuable opportunities and experiences in order to empower us as young people from marginalised backgrounds. And I would also say that the work that we do within Reach doesn't feel tokenistic. It feels extremely valued, and I would encourage other research studies if you want to work with young people, and when you're like interacting with young people, I would especially encourage to find value and like keep the value of young people's experiences at the heart of however you involve them, because we don't necessarily feel like we receive that support from mainstream politics or like the, I guess, mainstream media. I feel like particularly within politics, us as young people, we feel like very shut out and very disillusioned. So to be able to have these spaces where our contributions can impact policy change, can inform research, it gives us value and gives us motivation to continue doing what we're doing, and also to like try and like engage some of our peers as well to like really collectively, I guess, present like what our experiences are.
Thank you, Jonas. Wonderful.